First of all, I want to thank everyone here for coming, and I want to thank the organizers of this meeting for the tremendous amount of work they had to do to get this conference together. I'd like to thank the leadership of AMWA, but I especially want to mention Drs. Farzana Hafizullah, Dr. Kim Templeton, Dr. Teresa Rohr-Kirschgraber, and Dr. Eliza Chin for the support that they have given me over the past many years. And also, I must mention the many students and doctors who I've worked with here who have made my work in AMWA so meaningful and enjoyable. So thank you all. I am honored to serve you as president of the American Medical Women's Association. I will do my best to carry out the responsibilities entrusted to me, guided by previous experiences and knowing that you will be there to support me. Before continuing, I have to express my gratitude to everyone in this room. I've already done that. I must acknowledge one of my favorite scholars, Dr. Vivian Pinn, for her inspiring keynote address, of course, for her groundbreaking work advocating for research in women, her work in career reentry for women in medicine and science, and for her enormous courage to pursue a medical career in the 1960s. Dr. Pinn, you are amazing. You're a role model for many, and you're a role model for me. Thank you. The American Medical Women's Association advocates for physician wellness, and one of the strategies is to spend time with your family. So since I couldn't be with my family this weekend, I decided to bring them all here to this event. So will you please stand? I am especially thrilled that my two sons, David and Daniel Newman, are here. They have contributed immensely to my life through their love, creativity, humor, and to their support of my career as a doctor. They recently wrote an essay, The Doctor Who Raised Us, in which they said, and I quote, "We knew our mother as a doctor, so we came to see doctors as nurturing, gentle, and kind. Moreover, we came to see women as intelligent, capable, and strong. How could there be any contraindication in the twinned calling of Dr. Mom when the aptitudes of each are so clearly inseparable from the other?" Thank you. I also want to recognize my three brothers, Doctors Howard, Richard, and Mark Baum. Together, you might want to stay. We cover a wide range of medical fields: internal medicine, gastroenterology, endocrinology, urology, and radiology. Thank you for your support and for all the informal consults over the years. I am also grateful to my brothers' families, to my sisters-in-law, Carolyn and Linda Baum, and to my nieces, Alex and Julie Baum, and my nephews. My niece, Alex, has just started a pre-med AMWA chapter at the University of Michigan, so Alex is one of us. And I have to mention my cousins, Robert and Lisa, and Jeffrey and Robin Baum, and Lauren Baum, for coming tonight and for always being there to support me. And last but not least, here tonight are my special friends, Christie and Lawrence Brooks. Christie is the president and CEO of the largest Planned Parenthood in New Jersey, with 22 health centers which provide vital reproductive and other health services to about 100,000 people in New Jersey, most having incomes of about $37,000 or less for a family of 4. Christie? In AMWA, we value mentoring, and so I ask each of you to think about those people who helped you in your journey through medicine. I have had many mentors during my career, but now would like to spend a few minutes focusing on my early ones. My first mentor was my father, who's no longer with us. He is a pediatrician. He was the son of immigrants, and he had to support himself through medical school and college. His office was connected to our home, and if we were in our living room, we could often hear babies crying. My dad inspired me to become a doctor. He told me his stories about making house calls, about taking payment as, instead of money, taking food as payment, such as an apple pie, because people couldn't afford his small fees. And he also told me many stories of his work in a contagious disease hospital during the polio epidemic in the 1940s. So when I was 12 years old, I told him that I wanted to be a doctor, which I didn't know any women doctors, but I said, I want to be a doctor. So he actually encouraged me, and he introduced me to 3 women doctors in our hometown of Passaic, New Jersey. And then he told me a story. He told me the story of Dr. Helen Taussig, and he said that women not only could be doctors, but they could be great doctors, and they could make tremendous advances in medicine. As you know, Dr. Taussig was one of the first pediatric cardiologists, and she worked with others and developed an operation for babies with the blue baby syndrome and cured them. So my mother was not a doctor. She stayed at home and she took care of all of us. But actually, it was my mother who introduced me to the American Medical Women's Association. This is when I was in high school. She was really pleased when her friend and our next-door neighbor became the president of AMWA in 1968. I am talking about Dr. Laura Morrow, who was a psychiatrist and who is the mother of our beloved photographer, Mary Ellen Morrow, who was my neighbor. And Laura Morrow was really an inspiration for me, and I am wearing a pin that she used to wear perhaps 50 years ago, which is very special. In Dr. Morrow's inaugural AMWA speech, which was in 1968, she said the following, which is still relevant today. All the strong and brave women doctors from Elizabeth Blackwell and on have made a respectful place for women in medicine. It is our job to maintain their standards of excellence and service to the community, to help those who still wish to become doctors to achieve their goals. She then talked about the importance of non-medical community service and the unmet needs in health areas. 50 years later, we in AMWA have made a lot of progress in supporting family planning and reproductive rights, in gender equity, equal pay for equal work, HPV and cervical cancer prevention, and educating doctors about the signs of sex trafficking. Our Gun Violence Prevention Task Force has just completed their position statement, which we hope will be published soon. And we actually are working on a wellness initiative that will explore burnout, depression, and resilience, particularly in women doctors. We are convening our second educational conference on sex and gender medicine with the aim of bringing sex and gender medicine into the curricula of medical schools and other professional schools. We are dedicated to the concept of humanism in medicine, and we now have 4 groups working on literature, the arts, music, and film. I don't have time to mention everything we do, but I am very proud of all our programs and hope that you are. We are definitely making an impact. For those who know me and my career in cardiovascular disease prevention, it is not surprising that I am involved in the Preventive Medicine Task Force, which was founded by our former president, Dr. Farzana Hafizullah. And my area of focus within this task force is obesity, which is now considered a disease in its own right, a disease that influences other serious disorders such as diabetes, heart disease, and arthritis. And I'm looking at Kim Templeton as I say that, to name a few. The Preventive Medicine Task Force has just finished our first webinar about the pathophysiology and management of obesity, and this is just the beginning. We will continue to work on this disease, looking at it from a sex and gender perspective, as we must look at all diseases. During the year of my presidency, I would like AMWA to begin work on one of the most challenging problems facing the United States today, and that is opiate addiction. This affects at least 5 million people in this country and causes around 20,000 deaths a year and maybe even more. It is important that AMWA look at addiction through a sex and gender lens because we know that there is a greater potential for addiction in women, and there are grave consequences for pregnancy and the newborn. As a multi-specialty organization with members from all career levels within medicine, AMWA has the opportunity to provide a unique perspective on health and disease and to find solutions to medical and social problems. We have the creativity, skills, and commitment to do this. We also mentor each other and develop and nurture leadership skills in all of our members. I hope that everyone here and all AMWA members realize the power of our organization and its impact. I hope that each of you will continue your involvement in AMWA and as AMWA ambassadors, spread the word about our organization and encourage others to join. We have great ideas, but we have so much work to do, and we can only succeed if we have your commitment and support. So in honor of my husband, Dr. Jonathan Tobert, who is British and is not here tonight because he's in Oxford, England, and in honor of my stepdaughter, Dr. Vanessa Tobert, who just became a doctor this summer and is now an F1, which means she's an intern, I'd like to close with a quote from Shakespeare, specifically from Act 1, Scene 4 of Measure for Measure, a play that I studied about 2 years ago in my literature class in Oxford. The plot revolves around the imprisonment of Claudio, who received a death sentence for impregnating his fiancée. Claudio asked his friend Lucio to implore his sister, Isabella, who was about to enter a convent, to plead with Lord Angelo to set him free. But Isabella really doubts that she has the power to succeed, and she at first does not want to do this. So Lucio then says to her, this is the quote, "Our doubts are traitors and make us lose the good we oft might win by fearing to attempt." This is a reminder to me that as women doctors, and especially as AMWA doctors, we should not focus on weaknesses or limitations, but rather recognize our strengths, ask for what we deserve to have, and have the courage to combat injustice in whatever form. We must speak out and win the good despite fears and self-doubts. In closing, I want to thank you all for all that you've already done for women in medicine and the health of women and our communities. I am honored to serve as your president, and I am grateful for your support. Thank you.